I wanted to ask you what you see as that biggest disconnect actually between caregivers' needs and what the system is delivering currently.
Thanks, Oliver. Great question. Good morning, everyone. When I think about the biggest caregiver needs, just right off the top of my head, I think three things. Number one, respite. Number two, money. Number three, mental health supports. And I think that came out loud and clear in the survey. I wrote some stats down. Some of this is reiterating what James said, but I think they're worth hearing again. So, thinking about respite. 79% of people say respite is important. Only 7% of people are accessing it. That's a pretty big disconnect in the supports. People need a break. Number two, financial supports, money. 49% of people say they are reporting financial strain related to caregiving duties, and some are spending $12,000 out of pocket. I'm in Nova Scotia. We're so fortunate in Nova Scotia to have a caregiver benefit, and I'm happy to hear that soon that will be here as well. And the great thing about that caregiver benefit is it's $400, not $1,000 a month, as many caregivers are spending, but it's money that caregivers can use right now for exactly what they need. Whatever the greatest need is, they can use that money. It's not enough. There's a lot of eligibility requirements, but it's a step forward. And then the third thing is mental health supports. 77% of people are reporting negative impacts in well-being. And so I think we can do a lot more to increase mental health supports. But aside from those three biggies, I personally think one of the largest disconnects is the lack of identification and recognition of caregivers. So many caregivers don't even see themselves as caregivers, and I see that as a big, big problem because, they're a child, they're an adult child, they're caring for, they're a parent, they're a spouse, but until we can help people realize that they're also a caregiver, they're not going to be able to look outside of that and see what supports are available. And we're not going to be able to create this urgency of this caregiving crisis that we have on our hands. In fact, another stat from the survey, only 11% of people have been asked by a care provider what they need. We're very fortunate in Nova Scotia, again, that we actually received funding from the Canadian Centre of Caregiving Excellence to provide a pilot project around social prescribing. And if anyone here is not familiar with social prescribing, it's non-medical interventions for folks looking at the social determinants of care, of health. And so one of the things we've done for this project is we're bringing on partner sites. So we're looking at pharmacy clinics, we're looking at healthcare collaboratives, and we're bringing them on as partners with our organization, Caregivers Nova Scotia, to encourage them to refer caregivers to us. Because right now, the system is so geared towards that care recipient. And one of the things we're finding, and we've even heard as we're bringing on these partner sites, is that caregivers aren't the patient. And so we've been working at as much as we can to encourage folks to see that actually caregivers support that patient. So if you're not supporting the caregiver adequately, the patient is also then not being supported. In fact, we had one caregiver share with us that she stopped, goes back to financial support, she stopped purchasing her own medications for herself because she needed to pay for the medications for her spouse. That's just not okay. We need to support these caregivers, and we need to encourage healthcare providers to see that caregivers matter just as much as the care recipient. And that's a huge disconnect. I have so much hope that you're all here today. May is Caregiver Awareness Month, so I hope that, even just being here today and hearing all of these survey data, that it will help you think about caregivers in your life and encourage them to identify themselves as caregivers and reach out to the supports, especially right here in New Brunswick, where there's now a caregiving organization.